We're back here, 22 News in Focus, and today we are talking about children's health and well-being and the importance of maintaining regular preventative care with Dr. John O'Reilly, Chief of General Pediatrics at Bay State Children's Hospital. So because of COVID-19, there's a social distancing aspect going on here. So are you offering virtual or tele-appointments?
Well, we're offering in-person visits and telehealth visits, depending on the age of the child or their complaints. I think right now we're doing about 60% of our visits as telehealth visits and about 40% of our visits in person.
How effective are the virtual or telehealth visits?
Well, I think it depends on the age of the child, the concerns about the child. I think if a child is relatively healthy, has no chronic medical problems, and is growing and developing well in the school age, you probably can get a good handle on how that child is doing with a telehealth visit. With a little baby who are really concerned about how they're growing, what their weight is, their height, we're really concerned how their motor skills are, and there's a subtle difference, how their social skills are. Those visits we need to do in person. And similarly, for an urgent visit, if it's a question, is this a broken bone? Well, we need to see them. If it's a question of what is this rash? We can generally do it with a televideo visit.
What's a wellchild visit? And what are you looking for in that type of exam?
Well, a wellchild visit is really a holistic look at the child and a look at the family as well. So straightforward things, what's the child's weight, what's the child's height, what's the child's blood pressure. We get a sense where we then can talk to the family about nutrition. Is the child underweight? Do we have to worry about adding some different types of foods? Is the child overweight? Because in pediatrics, we now know we really start to prevent obesity in the first 2 years of life. So we can have those nutrition conversations. I think development is a critical thing for pediatrics. So the brain is changing at an amazing rate in the first 3 years of life. So we really want to work with families to know that the child's social emotional interactions are good, that their speech skills are good, that their fine motor and gross motor skills are good. Part of that is we need to know that the child is interacting well with the environment. Is their hearing good? Is their vision good? Because in that critical brain development piece, if they are not getting the stimulation to grow, either socially or visually or hearing, that's really going to impact their long-term trajectory. I think the other big piece that we deal with are behavioral health issues, because parenting is a difficult task, and each child is unique, and we need to help the parent learn about their child and learn the best and most effective ways to do behavior, to do help with development. And we want to develop basically good life skills so that when that youngster gets into kindergarten, he's ready, that we're socially and developmentally, that when that child moves on to middle school, we've talked about the things that the child may face. So pediatricians are very preventive. We want to give them guidance about how do we talk to your child about substance use or teenage behaviors or even the toddler with tantrums. So there's a wide range that's really dependent on the child and the situation.
And how often do you have these well visits?
Well, again, we talked about the multiple visits we have in the first 2 years of life. After that, it's basically every year until they're 18. And some kids with chronic illnesses or some kids with issues we want to see sooner, we will see in between those well visits. And we might identify an issue at a well child visit that needs a little bit more in depth and maybe a specialist input, and we'll continue to follow those children. But a healthy child, probably 6 visits in the first 2 years of life, and then yearly after that.
And then, back to COVID-19, but can you do these well visits virtually?
Well, again, what we're doing is trying to match the child and the age and the need with whether or not we could do it in person or whether or not we can do it virtually.
Because I'm
So
wondering, I'm just wondering with the developmental milestones, can you do that in a virtual visit? Or do you have to do that in person? It seems like it would be probably something you'd want to do in person.
Yeah, I think the younger age, the under 2, we definitely do it. And I think there's some parent sort of apps. So we use the CDC milestone app, and we might go over it at one visit and say, listen, here's a way to track your child. We're going to see you in 3 months, but if you see any of these problems with the milestones, we'll see you sooner. But I think for that age group, an in-person visit is important. And then before school, we want to know that that child is ready, so we have to really do that visit in person.
You mentioned, chronic conditions and stuff like that. How do you address the needs of children who has a child who has a chronic condition?
Well, the major ones we have asthma is a huge issue in Springfield, maybe 20 to 30% of our kids. We do see them in person, but we also have a lot of outreach with the nurses to go over medications, to go over things to do around the house. Same with ADHD and some school behavior problems. We'll have in-person visits, but we do a lot of outreach as well. So managing a chronic disease is a little more complex, but has a little bit more flexibility between in-person visits and telehealth visits.
All right, I want to talk more about asthma when we come back from the break. Also, COVID-19 and how it's impacting our children. You're watching 22 News in Focus.